And we'll now hear from Mark Nicas, a certified industrial hygienist and an emeritus professor at the University of California, Berkeley School of Public Health.
Thanks. I appreciate the opportunity to be part of this workshop, and I'll be offering several recommendations about masks available to the general public. I think that some of what I say may duplicate what Stephanie just said, hopefully at a minimum. Next. To begin, any type of face covering worn to reduce the amount of air pollutant inhaled, be it an N95 filtering-facepiece respirator, surgical mask, cloth mask, or a bandana, can be considered respiratory protection. However, within the world of occupational hygiene and OSHA standards, bandanas, cloth masks, and most surgical masks are considered not proper respirators. The reason is that they permit a lot of pollutant penetration into the face covering, and they are not approved by NIOSH. Next. This is my most colorful slide. This shows a NIOSH-approved cup-shaped N95 filtering facepiece respirator on the top and a cloth mask below. One difference is that the NIOSH-approved N95 has two straps that go around the back of the head, whereas the cloth mask has ear loops. A mask with head straps usually fits more snugly to the face than does a mask with ear loops. By the way, I am not offering an endorsement of this 3M product over other N95s. Next slide. Now, different face coverings provide different degrees of protection. A well-fitted N95 might permit only 5% inward particle penetration, whereas a cloth mask might permit 50% and a bandana might permit close to 100%. I'm going to focus on cloth masks because that's what I see most of the general public wearing at the moment, although some of my comments pertain to all types of respiratory protection. But here's my first recommendation. Next. The production of NIOSH-approved filtering facepiece respirators should be greatly increased so they are freely available to the general public without causing shortages for workplace use. Next. Now, I'm focusing on small particle pollutants because those are concerned with wildfire smoke and are present with infectious virus. For wildfire smoke, small particles can be considered those with diameters less than about 2.5 microns. And for virus and particles emitted from the respiratory tract, the particles of greatest concern may be up to 10 microns. Next. The penetration of pollutant particles into a mask without an exhalation valve can occur in two ways. The first is penetration through the filter medium, and the second is inward leakage of unfiltered air around the perimeter of the mask. If there is an exhalation valve, a third way can be inward leakage of unfiltered air if the valve does not seal well during inhalation. Next. There are different materials used to make cloth masks. Some have good filtration properties and some do not. A given cloth material might be excellent for removing 10 micron particles, but not for removing 1 micron particles. The latter material would be good against pollen grains, but not against wildfire smoke. We can't know about filtration performance unless we test the mask against different size particles, and that has been done for very few cloth masks. Next. Different masks make different fits to the same face, and the same mask differs in fit to different faces. It's akin to finding a well-fitting shoe. Let's say you have size 9 feet. Not all size 9 shoes will fit you the same way, and the shoe that fits you the best is not going to be a good fit for all other size 9 feet. The worse the fit, the more inward air leakage occurs around the mask perimeter. When we see someone wearing a mask that looks to have large openings at the sides of the face, we are looking at a lot of inward air leakage. Now, it's possible to use test particles to measure the degree of unfiltered inward air leakage permitted by a cloth mask, but we need to simultaneously account for the degree of test particle penetration through the filter. This has seldom been done for cloth masks and only in a research setting. Next. So this leads to my second recommendation for cloth masks. We need standard test protocols to measure the penetration of different size particles, to measure the degree of inward air leakage around the mask perimeter, and to measure inward air leakage through an exhalation valve. If testing were conducted or funded by a government agency, the results should be posted on a website for all to see, which would allow consumers to compare the performance of different masks. NIOSH would be the best agency to perform or arrange for such testing, although I think this effort likely falls more within the purview of the Food and Drug Administration. Next. In OSHA standards, when a worker is required to use an N95 filtering facepiece respirator, the fit of the N95 to the worker's face must first be assessed by what is called a fit test. The person wearing the N95 is exposed to test particles against which the filter has very good efficiency. If too many test particles are detected inside the mask, we conclude mask perimeter leakage was excessive and a better fitting respirator must be found. Most cloth masks would not pass the current fit test for N95 respirators because the cloth masks fit too loosely or the filter efficiency against the challenge particles is too low. Next. A second procedure required by OSHA is a seal check. Whenever a worker dons an N95 filtering facepiece respirator, the worker is supposed to do a quick, crude check for excessive air leakage around the mask perimeter. Test particles are not involved. My opinion is that most current seal checks of filtering facepiece respirators are not reliable, but it definitely would be useful to have a reliable point-of-view seal check. Next. So my third recommendation, an effort should be made to devise a fit test and a seal check procedure for snugly fitting cloth masks, perhaps for those that in the future are equipped with head straps. The required materials would have to be inexpensive and easy to use. I suspect a small minority of the general public would avail themselves of these procedures, but the procedures would benefit those who did. Next. The final area I'll address is the concern about inhaling excessive carbon dioxide when wearing a cloth mask, a surgical mask, or an N95 respirator. The air we exhale contains carbon dioxide levels at about 40,000 to 50,000 parts per million, or ppm. At the end of an exhalation, some volume of the exhaled air gets trapped between the mask and the wearer's face, which is what is termed the mask dead space. That trapped air is re-inspired upon the next inhalation. Inhaling carbon dioxide at 40,000 to 50,000 ppm can have adverse effects, but the carbon dioxide level is about 10-fold lower in the total volume of air inhaled during a breath. Next. Here are some ballpark estimates. A cloth mask dead space volume might be 100 milliliters, and the volume of air inhaled per breath while doing light work, say while walking on the street, might be 1,200 milliliters. If the carbon dioxide level in ambient air is 400 ppm, and if it is 45,000 ppm in exhaled air, the carbon dioxide level in the 1,200 milliliters of inhaled air is about 4,100 parts per million. I do not think 4,100 ppm is a dangerous level of carbon dioxide, but I'll punt and leave it to medical and physiology experts to make the final judgment. I do note that given the tens of millions of people in cities in Southeast Asia, China, Japan, and Korea who have worn cloth masks and surgical masks for a good number of years, and given the millions of U.S. workers who have worn respirators for decades, if inhaling 4,100 ppm of carbon dioxide caused serious health effects, I think we would have seen them by now. Next slide. So my final recommendation, rather than rely on my ballpark estimates, a laboratory chamber study should be conducted in which different masks are placed on a breathing mannequin that inhales air at different volumes per breath to mimic different work rates. The carbon dioxide level in the exhaled air would be controlled at 40,000 to 50,000 ppm, and the level in the test chamber would be controlled at 400 ppm. One could then measure the average carbon dioxide level in the inhaled air volume when wearing different masks at different breathing rates. I think that would be a relatively straightforward study to perform. And those conclude my comments.